Hi, this is Ioachimescu, and this is a recording of our first presentation in the implementation science for innovation and discovery. Welcome. This is the agenda of the seminar on the 24th of April, 2023. And I will be talking to you today about the landscape and the language of implementation science. These are my disclosures. Over the past couple of years, Emory University and Atlanta VA Medical Center, as my employers, received funding from the following sources: AstraZeneca, Lilly, Merck, Sanofi, Department of Veteran Affairs, Federal and Drug Administration. There will be no off-label medications or unapproved devices that will be discussed during today's presentation, and there's no conflict of interest or commitment with today's talk. But the most important disclosure of all is that I'm not an implementation scientist. The goals of today's talk are to familiarize yourself with the general language and several taxonomies, theories, and models and frameworks that we use for implementation science, understand how quality improvement and change management concepts intersect with the implementation science constructs in the journey of discovery, and list several concepts related to application of implementation science in other areas. And we'll be touching a little bit on maturity models, how to use implementation science in education and in patient-centered care. This slide shows a cartoon of somebody who's finding a treasure, $10,000 underneath the roots of the tree. But when the treasure is taken out, it's only $100. The trivial solution to that is that this is a square root of the 10,000. The more qualitative and I think more important interpretation of this cartoon, and that's the purpose why I put it here, is that sometimes we fail to capitalize on new discoveries, and the treasures that seem to be very valuable sometimes do not translate into the same value as we expect. And the second cartoon says, behind every failure, there is a treasure, you need to find it. That kind of aligns a little bit more with quality improvement concepts, with root cause analysis, and they both actually are very, very relevant to the field of implementation science too. So you may ask yourself, why implementation or why implementation science? Well, it turns out that it takes about 17 years for research findings to be taken up into practice. It may take up to 12 years to develop a new medication, and sometimes longer than that. And only 1 in 10 successful data science projects that use data from healthcare end up being applied in medicine. So to me, that's a huge research to practice gap, and not only to me. And this spurred the development of the implementation science, which is defined as the study of methods to promote the systematic uptake of research findings and other evidence-based interventions or practices. And you'll see this syntax, evidence-based interventions and practices, repeated in today's talk. And we want the uptake of these practices and interventions to be applied in routine practice in usual care. With the overall goal to improve the quality and the effectiveness of the health services and care. Synonym terms: implementation science, dissemination and implementation research, knowledge translation, implementation science research also, and we'll come back to this. Implementation science draws from, and it's related to a few contiguous disciplines, if you want. Public health is one major one, but there are also the fields of psychology, sociology, organizational theory, human factors engineering, and so forth. So I went back to the most important resource for a researcher, which is dictionary.com, and tried to define implementation. And I found interesting that there are a few synonyms such as employment, enjoyment, fulfillment, performance, play, pursuit. And if you are stuck with the opposite, be aware that the antonyms for implementation are dissatisfaction, failure, idleness. So there's a little bit of a danger to be sticking with the opposite. So I'll walk you through a few key terms, one of them being the implementation. And as I mentioned earlier in the definition of the implementation science, implementation really applies to the degree how we get best practice findings and related products from research most of the time into routine and sustained use via change, uptake, or adoption interventions. And it's important to understand that the concept of implementation is not equivalent with the fidelity of or procedures of a study in particular, for example, in the case of a clinical trial, but how the intervention was applied. And the dissemination, since you may see the term dissemination or implementation a lot, to me and to a lot of other scholars in the field, dissemination is really a part of implementation. And the dissemination relates to how we communicate tailored information to target audiences with the goal of engagement and information spreading. So as I said, dissemination is included in the larger term of implementation. So I defined it already. This is the methods and strategies for integrating evidence-based practices into real-world settings. It does focus on understanding and overcoming barriers and challenges for successful implementation of these evidence-based practices and interventions. And I'll give you a few examples: lack of resources, limited stakeholder engagement, inadequate training, lack of leadership support could be some of the more usual barriers. While implementation science is really taking the systematic approach of designing, testing, and refining the implementation strategies. And the randomized controlled trials, the most rigorous approaches and methodologies are often involved and applied in this endeavor. So you may say, I'm sold on the concept of the implementation, but do we really need another field, another science applied to this? Well, it turns out that the answer is yes, and mostly because the initial attempts to do this were very empirical, did not always pay attention to any theoretical underpinnings, and hence they became an expensive version of trial and error, as Eccles put it very nicely in one of the recent papers called Changing the Behavior of Healthcare Professionals, the Use of Theory in Promoting the Uptake of Research Findings. And the poor theoretical grounding can make it difficult to understand and explain why and how implementation either succeeds or fails. And thus, the failure can actually limit the opportunities to identify what are the predictors of failure, and the same thing, success can actually be blinded, if you want, by the real drivers, the predictors of success. And the goal is to actually devise implementation interventions or strategies, bundles of interventions that will be successful. Davis published in 2003 an evaluation of guideline implementations and found out that actually 10% of the implementation studies that looked at specifically at guidelines implementation provided the rationale for their strategies. There are mixed results of implementing evidence-based practices in various settings, and that's probably based because it has been either not very rigorous in approach or did not use theoretical basis for applying in a systematic fashion. In the last 2 decades, the implementation science has seen much wider recognition of the need to establish the theoretical basis of implementation. And there is a mounting interest, there is an exploding interest in the use of the standard theories, models, and frameworks that will provide insights into the mechanisms and how to devise implementation strategies that are successful. Implementation science really used theories borrowed from disciplines such as psychology, sociology, organizational theory, but also frameworks and models that have been developed within the field per se. So I would touch base in the next slide on the key concepts of implementation science. And one of the key ones, one of the basic ones, is fidelity. And it really relates to the degree to which an intervention is implemented as intended or specified in the original research study or evidence-based practice. And it includes the degree to which the core components of the intervention are delivered, looking specifically at the quality of the delivery and the consistency of the intervention across different settings and populations. And really, Fidelity ensures that the intervention is actually leading to the expected outcomes, and thus enabling replication and comparison of results across studies and maybe generalizability. The sustainability, it's another major domain, major dimension of implementation science, and it relates to the long-term maintenance of an intervention or an evidence-based practice after the initial implementation actually finished. And there are multiple factors that influence it, of course, organizational culture being a major one, resource availability, and that goes from dollar amounts to time amounts, stakeholder buy-in, ongoing support, and continuous monitoring. Really, the sustainability ensures that the benefit of the intervention are maintained over time, and ways to maximize the return on investment in implementation efforts, which is such an important component for the leaders when they look at if an intervention or an evidence-based practice is worth deploying. The adaptation is really the dimension that allows us to make modifications or adjustments to an intervention or an evidence-based practice once we try to implement it, to apply it to a target population or a more specific setting. And the acceptable degree of adaptation depends on the goals of the intervention, the nature of the modifications, and the potential impact on the outcomes. Adaptation is necessary to increase acceptability most of the time, feasibility and relevance of the intervention in the local context, but it can also pose a risk to fidelity and effectiveness of the intervention. So it's a fine trade-off between fidelity and adaptation, and with the final implication that sustainability could be also affected. So what do we really aim to accomplish when we're using the tools of implementation science? I would categorize it this way. There are three main aims, if you want, to describe or to guide the process of translating the research findings into practice, to understand and explain what are the drivers of success or failure, what influences the implementation outcomes. And of course, we want to study outcomes when we implement a new practice, and to evaluate the implementation per se. How did we do it? For using implementation science in research, one of the more important dimensions is how do we design the interventions that are more likely to be successful and adopted by end users. The second one is to evaluate the effectiveness of the implementation strategies and to identify which one is in fact the most effective strategy or the more likely strategy that will be successfully implemented and adopted, and also to allow us to use the model, the implementation strategy, in a different setting, on a different population, in a different context. So that's about the generalizability and the scalability of the research findings in a different context. As I mentioned earlier, methodologies can vary a lot, but they are typically very systematic. And one of the key designs or methodologies to be used are the randomized controlled trials. They evaluate the effectiveness or the efficacy or the impact of outcomes of implementation strategies. They can establish causality given their random assignment to groups. They can test effectiveness of intervention and identify which factors are influencing the outcomes. The mixed methods designs really involve a hybrid of qualitative and quantitative methods in a single study. And these are very useful because they help us understand better the complexity of the intervention or the implementation and identifying which contextual factors may influence the success. The researchers, for example, they can triangulate findings from different data sources, from interviews, from surveys, administrative data, for example, to gain a more comprehensive view or understanding of the implementation process. The implementation process evaluation per se, it's another important way, and again, looking at barriers and facilitating factors, and in the same time, paying attention to the fidelity and how do we assess the quality of the implementation. And process evaluations can actually help identify areas where improvement is needed to ensure successful implementation. And here is where QI projects can actually be pegged on the specific evaluation of the implementation process. The quasi-experimental designs are employed when randomization is either not feasible or not ethical, for example. And these designs compare outcomes between groups, but then the way you assign folks in different groups may be a key component of how one designs those specific studies. And case studies or use cases are detailed, in-depth analysis of a specific implementation effort. They are very useful to understand the context of implementation, given their practical approach and their real nature. The fact that somebody has gone through that specific journey may be relatable. The specific challenges that they encounter and what strategies were employed to overcome those challenges can be very important. And it can help us to scale up or to apply different implementation interventions in different settings. And using the best practices and the lessons learned from the case studies, the same as we would do from a case report in clinical medicine, is very important. Stakeholders are not the ones that are holding the steak knife in the back. And I like this cartoon because it says some stakeholders are completely behind the project so they can stab it in the back. The stakeholders are really supposed to be having a vested interest in the implementation effort, and they can vary from patients, clinicians, staff, administrators, funding agency leaders, community members, policymakers, etc. They play an absolutely essential, a critical role because they can provide insight, they can also provide support and resources that will help us be successful in the implementation efforts. So they identify the needs and priorities, they look for resources, they engage additional stakeholders, so that could be extremely important for people to disseminate it. And they offer perspectives on the feasibility. Ongoing support and advocacy is extremely important for the sustainability part of the effort too. This is a nice diagram from a model proposed by Dr. Saldana, looking that besides stakeholders, you actually do have to pay attention to who are the agents of implementation, who in fact is going to do what we aim to do. And this goes from patients, practitioners, what systems do we have in place, and then who's going to develop the specific program, who are the champions, how do we involve leadership so that they become agents of change for us, and of course, not to forget about the client or the end user, the patient, most of the time. And payers are another important component there that we have to pay attention. Resources are not unlimited. So the skeleton of implementation science is really represented by theories and frameworks. The theories are the systematic ways of trying to understand the events and behaviors that lead to the interrelated concepts. In my mind, this is the mathematical equation that links the variables in a specific way with specific strengths of relationship. The theories are typically abstract, they are general, they are broadly applicable, they are not content, context, or topic specific, while the frameworks are really the proof from hypothesis to the quoderant demonstrandum to the final conclusion. How do you demonstrate from the hypothesis through specific steps? And they can be frameworks that are strategic in nature or can be very well action planning frameworks, but they provide the systematic cookbook, the steps that you have to go in order to develop, manage, and evaluate interventions. So we're not going to go in depth about the theories, although they will be part of the future presentations where we're going to, analyze a little bit more in detail different theories. We will get ourselves familiarized in the future presentations with different frameworks, and integrating the theories with the frameworks will actually provide us, the models of implementation. Just to provide you a nice categorization of the different theoretical approaches or different theories, they are some that are actually apply to the process. So these are process models. They are specific theoretical approaches that look at context, and they could be determinant frameworks, really analyzing the context. But there are others that are classic theories and implementation theories. And not to forget that evaluating implementation per se has a very important value. And we do evaluate the frameworks for use for the implementation science. And I will just walk you through a few of these process models. I'm just exemplifying here with 5 major ones frequently used in medicine: exploration, preparation, implementation, sustainment, or EPIS model. PRISM, practical, robust implementation and sustainability model, is another common one. And then one that is contingent to quality world is quality implementation framework. When we talk about determinant frameworks, what theoretical approaches do we have for the context? The active implementation framework is one of them. The more commonly used consolidated framework for implementation research, or promoting action on research, implementation, and health services, for example. There are classic theories, and then there are organizational theories, behavioral theories, social and behavioral theories. And last, it's the diffusion of innovation, which relies a little bit of a more passive approach, where the innovation will actually transcend its gradient. And this model has been adopted by the Veteran Affairs Administration, having now an office of innovation that relies on this type of theory. And extremely important are the implementation theories. So these are theories that have been developed in the field per se, not necessarily borrowed from other fields. And implementation climate is one of the theories, organizational readiness for change, normalization process theory, and so forth. I would mention that when one looks at the different steps and different specific theories or frameworks, assessing the organizational readiness for change is really an extremely important step. Without paying attention very rigorously to how ready is the organization for change, implementations can fail very miserably. One important slide, or maybe the most important slide of today's talk, is the subway schematic for implementation science. And it starts with the station where we want to identify first what's the intervention or practice of interest. And then immediately an implementation scientist would analyze the data behind its validity. How well was this intervention or practice of interest have been proven in various studies? So the first question is the intervention or the practice of interest efficacious? And if there have been no studies published that the intervention is efficacious, it's time to design the implementation, the efficacy research. It's time to start designing and then implementing those. And these are sometimes studies that are similar to the phase 2 or phase 3 trials, randomized clinical trials for medications or for equipment. You really need to have that proof of efficacy first. But if there are already studies out there showing that the intervention or practice of interest, the device, the educational intervention, the guideline application, whatever the intervention is, it's efficacious, then the next question is, in the real world, does it pan to be effective? And those are the effectiveness studies. And if there are no effectiveness studies, then you engage in effectiveness research, real world assessment. After a medication has been approved with successful phase 2 and phase 3 trials, then you do phase 4 trials and the point of care assessment sometimes. Real world proof of efficacy, not as much as in the controlled environment of the efficacy trials. But if you have enough evidence that the intervention is both efficacious and effective, then that's the time when you start designing the implementation studies. And you may start with the mixed method studies to understand the context, and then you design the implementation strategies with the agents of change and with the stakeholders, and then you test the implementation strategies. Sometimes you deal with an intermediary situation where the intervention is either proven to be effective and efficacious in a specific setting or in a very particular context. or in a particular subgroup of patients, but not clear if that applies to other context settings or patients. And that's where you can actually go ahead and try to implement the hybrid effectiveness implementation trials. While they are a little bit more labor intensive and require the expertise of implementation scientists, they are very swift and very fast improving the intervention or both the implementation and the clinical intervention. So these are the three major lines, if you want, on the subway: efficacy research, effectiveness research, and implementation research. So the clinical interventions, as physicians, as healthcare practitioners, we understand very well. We talk a lot of times about what clinical or therapeutic practice, for example, the use of aspirin after myocardial infarction, or a delivery modality, an organizational arrangement such as chronic care model or acute care model or process, or health promotion activity. We want to test, look at the outcomes, and then try to apply it. The implementation intervention is a method or technique on the other side designed to enhance the adoption of the clinical intervention. For example, how do we make sure that more than 98% of our patients with acute myocardial infarction receive aspirin in the first 6 hours? And there could be different strategies and different ways to apply this type of implementation intervention. And the strategy, as I mentioned earlier, it's really a bundle of the implementation interventions. So we may look at different measures that put together in a bundle may make the implementation successful. I mentioned earlier the middle line between the effectiveness and implementation. These are the hybrid designs. You want to have a dual focus on assessing both the clinical effectiveness and the implementation. The hybrid designs can take 3 approaches. One is that you have co-primary aims. One is a clinical intervention, one is a implementation intervention, or you may have a primary aim that is directed at clinical intervention and secondary aim for implementation strategy, or the other way around. But you really have to aim from the beginning and specify what are the specific aims. Funding agencies nowadays actually require, even when you do an implementation, pure implementation study, to take a look at a secondary aim at the outcomes. And for sure, if you're doing a hybrid design, they will want you to analyze the outcomes and make sure that they are pairing or going in the same direction as the earlier efficacy and effectiveness studies. So while clinical effectiveness trials, they test the clinical intervention, the units are typically patients or clinics or hospitals, and we look at health outcomes, we look at process and quality measures, and then costs, but these are not necessarily the primary outcomes. The primary outcomes are typically clinical outcomes, right? While implementation trials, they study interventions or bundles of interventions or strategies. The unit is for the randomization is a provider, a clinical unit, healthcare system, something larger than one small, clinic, typically. And while the typical unit of analysis goes from healthcare practitioner, clinic unit, or system, the summative outcomes really relate to the uptake of the clinical intervention, the adoption. What are the measures of quality that are influencing the outcomes of the intervention? So here we're changing gears and we're looking at the implementation science from the lens of change management. And I have picked up this picture that is about a rider, an elephant, and the third component is the pathway. And the rider represents the leader, the investigator, the rational thinker, the analytical planner, the evidence-based decision maker, if you want. But in the same time, it could be the navel gazer. It could be the analyst that is paralyzed by discordant results, by the uncertainty, by too many complexities in the system. The second component is the elephant. And the elephant represents in this dyad, which was in fact developed by Jonathan Hay, the psychologist at the University of Virginia. The elephant is the worker, is the doer, is the grassroots agent, the implementer, the emotional player. It's very strong, and if motivated, can really take the rider and the entire system to the path of success. If unmotivated, the elephant may start pulling into a different direction. And despite the fact that the rider may be very persistent and very deliberate in pulling in a specific direction, ultimately the elephant wins. It's more powerful in the long run, and it's able to provide that persistent pull in a direction that may not be desired. The third component of this is the path, and Chip and Dan Heath used this triad, the rider, elephant, and the pathway, to come up with a recipe for change. And again, implementation science from the lens of change management or change leadership. You have to direct the rider, you have to motivate the elephant, and you have to shape the pathway. These are the three major components. The framework seems pretty easy, in fact, but we all know it's never easy to implement change. When one assesses an organization's ability to change or to implement a new strategy, a new intervention, there are different organizational maturity levels, which, if one looks at it from an evolutionary angle, there are stages of development of an organization that grows and improves its processes, the procedures, and the overall performance. And I listed here a few stages or levels that an organization may have from the lens of a specific framework. The organization can be ad hoc, can have some repeatable processes or reactions or procedures to a specific situations, or can be more defined, more managed, or even optimized. And in order to come up with the specific levels, there are different organizational maturity models that can be used as more theoretical, more general kind of frameworks. These models typically describe different levels of maturity, and they provide guidance on how to progress from one level to the next. And then one can look at particular components or particular areas of the infrastructure. For example, the IT infrastructure, the digital infrastructure, which is so important nowadays in healthcare. And from the angle of one specific model, one can identify chaotic organizations or more reactive organization or proactive, and then towards the more optimized part of the spectrum, service aligned and then business aligned type of organizations. As I mentioned earlier, we will touch a little bit on to what extent implementation science and quality improvement intersect, but at the same time, they are very different. So they are, in fact, complementary fields. They share similar goals of improving the healthcare outcomes and delivery, and they can be very well integrated to improve the uptake and the sustainability of the evidence-based practices in the real-world settings. But there are also key differences. So implementation science relates to the process of translating the research evidence into practice. It aims to identify the best ways to implement evidence-based practices in real-world settings and improve the uptake and the sustainability of these practices. While the quality improvement part is in fact a more practical and iterative approach to improving healthcare delivery. It focuses on how do we use the data in order to identify areas of improvement or areas that need improvement, and then testing the different interventions. And from the frameworks of Lean Six Sigma, for example, we typically do it on a small scale, small teams, relatively well-defined time frame, and then we try to scale it up from there. It can also look at failures or near misses, and we may do the root cause analysis type of approach. But this is very practical and very targeted to a specific context, situation, or outcome. So the QI typically involves continuous measurement and feedback, and the goal is to make the incremental improvements in the processes sustainable over time. So while they may have different approaches, they actually can be integrated to have common goals. For example, implementation science can be very well used to identify evidence-based practices that can be tested through the QI initiatives. But QI can also provide data on the effectiveness of implementation strategies, inform future implementation efforts. So sometimes there are implementation science frameworks that actually incorporate QI principles, such as plan, do, study, act, or plan, do, check, act cycles. These are methodologies that involve planning an intervention, testing in a small-scale pilot, studying the results, and then acting on the findings to make improvements, and then continue the cycle and hopefully scaling up at a larger level. So I have added this slide. I know it is a wall of words, and the star there is to remind me that this is the slide created from ChatGPT. I asked ChatGPT what's the intersection between implementation science and quality improvement, and came out with this series of words. I think in general, it's pretty true what it says there. If you do see sometimes slides that contain 2 or 3 bullets followed by a conclusion such as overall, so and so, it may come from ChatGPT. So be aware of this type of new resources and way to verify what we say through the use of artificial intelligence. There are, of course, barriers to potential implementation. If implementation is changing the environment, of course, there's going to be resistance to change. And the drivers of resistance to change can vary from lack of resources, from time availability to money, to staff, faculty, poor communication between stakeholders, and this is a major one, and this is where the dissemination component becomes extremely important. I mentioned resistance to change. There is inertia, there is apprehension about new things, and preserving the status quo becomes the default a lot of times. Sometimes it's hard to implement if there is limited access to new information, to what the research findings provided in terms of improvement. And sometimes it can lack the organizational support, lack of leadership engagement and buy-in, and that would be paralyzing, really. And sometimes inadequate training. Once we identify what educational resources and what information base has to be disseminated, if we don't provide the mechanisms of adequate training for our stakeholders and agents of change, that can fail also. Implementation science has been used for cost effectiveness also. So one can look at what's the fidelity, what's the adaptability, what's the sustainment of a specific evidence-based practice over time, but it can also look at how cost efficient it is, how much it eats into our resources, and that's an extremely important component. Similar to the world of QI, it can identify bottlenecks, especially in the linear processes, and then it looks at how can we improve those bottlenecks, what mechanisms are to be applied in order to increase the flow at that particular point. And then, of course, we have to be aware that there will be additional bottlenecks created either more proximally or more distal from the initial one. For clinical and translational research, there are different strategies, but they rely on these major components: training and education, clinical decision support, audit and feedback, organizational change frameworks, family and patient engagement, and of course, stakeholders engagement, very important, and having the right mechanisms in place for continuous improvement. And I didn't want to miss what are the tools and the specific strategies used for dissemination. It goes from the traditional academic publications all the way to poster sessions and meetings. Presentations, they can be very useful because they can provide the opportunity to engage in a more interactive way with other stakeholders, answer questions, receive feedback. Social media has become a major way of disseminating findings, very impactful. There are webinars that can be provided. Infographics and visual aids have been becoming more and more used in our fields because we're trying to target audiences with maybe a lower health literacy or not necessarily from our subspecialties. And press releases also are very important. Interviews, science cafes or science journal clubs for lay people and so forth. Implementation science can be used successfully if designed properly for patient-centered care. In order to have a patient-centric delivery of care, it's very important that we understand what are the patient's needs and preferences, what are the choke points, what are the specific pain points of the patient experience, identify what are the effective interventions to solve those, and then kind of come together with more complex strategies for implementation that we develop with our stakeholders. And we want to make sure once we put those in place, we have the mechanisms to measure the outcomes of those interventions and reevaluate, similar to the PDCA cycle, as I said earlier. This is another wall of words from ChatGPT. It kind of says what I already mentioned in the previous slides, and it builds these specific steps for sustainability. Engaging stakeholders, absolutely essential. Establishing partnership with grassroots, but also above. All of us are middle managers in a way. We have to pay attention to the both sides of the equation. We have to monitor the implementation outcomes and adapt to the local context. We have to build the capacity, fix the bottlenecks, and then again, we have to disseminate the findings. Implementation science has been used successfully in the field of education, and they can be used for in planning, adoption, or maintaining different educational evidence-based practices or intervention. And I would list here 4 categories or 4 strategies to be using implementation science in education. One of them is the so-called intervention mapping. And this has become a little bit more and more frequently used nowadays in the field of education. It's planning process, and it involves 6 steps. One is conducting a needs assessment, and then is defining what behavioral, environmental, social outcomes do we expect from that specific possible new intervention. We then go to the theoretical frameworks and find what theory-based method or practical strategies we will be deploying. And then we develop the test and test the intervention component. So each component of the intervention has to be defined. And then we plan for the implementation and adoption, and then we plan for the evaluation process. So kind of a similar kind of systematic stepwise approach used for a specific educational offering or implementation. We want to identify what are the facilitating factors and what are the barriers. These are the implementation drivers. They are the same as in other areas: leadership support, staff buy-in, learner buy-in, ongoing coaching and feedback, and so forth. Implementation science networks started to develop even in the field of education. There is, for example, a Society of Implementation Research Collaboration and the National Implementation Research Network. And these are important forums for sharing best practices, developing new tools and resources, and conducting research that can actually lead to improvement in adoption and sustainability of different educational practices. And then there are standard implementation planning tools that are becoming available. For example, on the Active Implementation Hub, there are a range of tools and resources that are able to help us with the implementation efforts in education. Before I finish, I wanted to say that the current educational series on implementation science, called Implementation Science for Innovation and Discovery, is designed initially with a more empirical approach, but I would like to make it meta-implementation, if you want, to even the curriculum to be developed in a very rigorous scientific pattern. And for that reason, I chose this Getting to Implementation Teach framework that has been published this year, actually last year, 2022, that it's actually looking at the different components. One is to define the implementation problem. The second one will be conceptualize the problem. We need to prioritize what are the implementation barriers and facilitating factors. Then we want to select and tailor maybe practical application or implementation strategies, and we'll have some journal clubs that will look at that. And then maybe in small groups to design different studies, different bundles that we want to put together and assess the outcomes of that implementation intervention. And then we look at what are the possibilities for maintaining, for sustaining the implementation long term. So meta implementation, really. And the paper is also getting into details. So very good framework, I think, for teaching implementation science and defining specific competencies to be covered by this framework. So for example, today's talk is under the category of defining the implementation problem. And I wanted you to be able to understand the general terminology, to define what implementation science is versus what is not, differentiate between implementation science research and the related disciplines. And we spoke about QI, patient-centered care, cost effectiveness, education. And then we will have in the future different evidence-based practices that have been exemplified in different papers, for example, in journal clubs worth implementing. We will have a talk about the implementation when you have either an unsuccessful or something that did not work as expected, as intended. How do you de-implement and adapt and maybe re-implement something else? There will be talks and presentations that will be under the category of how do we conceptualize different strategies, models, and frameworks in practice. And then how do we prioritize about the methods to apply and to employ different analytic strategies to measure the partnership for implementation science research and so forth. And as I mentioned, we will have a few sessions that will be more practical, either journal club or actually seminar type of discussions in which we want to select and tailor specific implementation strategies. How do we design an implementation study? And then how do we evaluate those implementations? And there will be some talks also that look at the implementation sustainability. When we conceptualize and define the problem, we will dive a little bit deeper into change leadership versus implementation science, quality improvement versus implementation science, maybe a framework like Malcolm Baldrige, implementation framework that is actually deriving from the quality improvement world. And we will have a series of internal and external speakers that will actually providing the knowledge needed for us to acquire these competencies. The ultimate goal of today's talk and of this educational series is actually to engage folks with interest and/or expertise in implementation science to create a learning community that over time will be able to operationalize either consultative services or actually operational services for various units who want to scale up research findings into the real world practice. And I will thank you for your attention here. Thank you very much for your attention. And we'll see you next time at our next talk in the Implementation Science for Innovation and Discovery series. Thank you so much.